Chapter 1. Alcohol. A few key facts. What is it? Fermented from fruits or grains, alcohol, or ethanol, can be found as beer, wine, or spirits. The type of drug is a depressant, but it can seem to have stimulant effects at low doses. Globally, it's an extremely popular drug, legal in most countries, although some religions do not permit alcohol consumption. And how is it consumed? It's drunk, which is also how you'll end up. Peak intoxication is about 45 to 90 minutes after consumption, and some of the effects include sociability, lowering of inhibitions, loss of motor control, and impaired judgment. When we talk about alcohol as a recreational drug, we really mean ethanol, a particular type of alcohol that is produced when sugar is fermented by yeast. Alcoholic drinks are usually made from fermented fruits or grains and broadly fall into three categories: beers, wines, and spirits. Alcoholic drinks have a long history of use across the globe, from Stone Age beer jugs to ancient Egyptian brewing and Babylonian wine deities, and they are very much ingrained in many cultures worldwide. Ale was extremely popular in the Middle Ages in the UK, though it was much weaker and consumed daily in large quantities, potentially by all ages. While underage drinking is discouraged these days, alcohol is still very much part of British culture. Office of National Statistics figures from 2017 found that only 16% of white adults in Great Britain reported being teetotal, although the figure was around 50% for other ethnicities. But while alcohol remains the drug of choice in the UK and in much of Judeo-Christian culture, there's some suggestion that this is changing. Certainly in the UK, and in many Western cultures around the globe, there is one group of people in whom drinking rates are going down, and it's not necessarily the group you'd expect. In fact, it's young people, defined as those aged 25 or younger in most places. For this group, national statistics suggest that the number of drinking occasions in a given month is lower than it's ever been, and there is a larger proportion of teetotalers in this group than at any time since data began being collected. At present, it's not really clear why we're seeing this drop in alcohol use in young people. Perhaps this group spend their time differently than the same age group did in the 1990s or 2000s. Preferring to socialise online, at home, or maybe even worried that drunken photos will be uploaded online before you can say Instagram. Perhaps public health messages about the harms of drinking are hitting home. Maybe young people are rebelling against the heavy drinking of their parents' generation. In all probability, it's unlikely that any one factor will be solely responsible. It may even be a statistical anomaly. What goes up must come down, and alcohol use in young adults was at its highest around the year 2000, so perhaps this fall is to be expected in the ebb and flow of population health behaviours. It's hard to say, and just because young people are drinking less regularly doesn't mean they aren't still partaking in dangerous drinking patterns. When young people are drinking, they're still reporting binge drinking to the point of illness well above recommended levels. In fact, the 2017 ONS report mentioned above found that while young people aged 16 to 24 years old were less likely to drink than any other age group in Great Britain, they also found that when they did drink, they were drinking more on a given day than any other age group. But what does alcohol do to us when we drink it? What are the short-term effects? Many people listening to this are probably familiar with the symptoms of alcohol intoxication. I know I am. Alcohol takes between 10 minutes to an hour to get into the bloodstream, and its effects vary depending on the dose. It might take 45 to 90 minutes to feel the peak effect of a drink once it's been consumed. After an average drink, you might feel more sociable and warm, the feeling described as tipsy. At this level of alcohol consumption, your heart rate has increased, and your blood vessels have dilated. Your inhibitions might be slightly lowered too, and you might feel relaxed. As you drink more alcohol, the effects get more pronounced. You can start to feel lightheaded, and you might struggle with fine motor tasks. Ever tried threading a needle while drunk or trying to unlock your front door? As well as these physical effects, your judgment and decision-making can become impaired. This is why drinking in moderation can be so difficult. It's easy when sober to decide that 1 or 2 drinks is all you're going to have that evening. But once you've had those drinks, even just 1 or 2, you might feel less concerned with your plans for the next morning and more keen to carry on with the night. If you do continue drinking beyond this point, things can get worse. You might experience memory blackouts. You could end up nauseous and vomiting. Your motor control will get worse, potentially leading to stumbles and falls, and this, combined with the impaired judgment, can lead to serious accidents. There's some evidence that alcohol intoxication might increase aggression, but at the moment it's pretty weak. What might explain the fights that seem to occur more often among intoxicated people could be an increase in misinterpreting ambiguous emotional faces. If you see a person with a neutral expression when you're sober, you probably think nothing of it. But while drunk, you might misinterpret that lack of a smile as aggression. And if that person is drunk too, that misinterpretation could escalate. Maybe it's due to a lowering of barriers that keep us conforming to social niceties and expectations. Intoxication is also associated with increased risk of sexually transmitted diseases and unplanned pregnancies. When we're drunk, we're more likely to partake in risky behaviours, and this can include unprotected sex as well as fights. Within the brain, alcohol affects almost every neurotransmitter that we have. These are the chemicals that transmit signals between our brain cells. Different neurotransmitters are associated with different pathways or networks in the brain, so manipulating particular ones will lead to particular effects on bodily functions, ability to think, motor skills, even emotion or mood. Alcohol is often referred to as a global or dirty drug, and it's this effect on so many different neurotransmitters that can make it appear like a stimulant or a depressant depending on the dose and the time after drinking. For some people, the consumption of alcohol, even at low levels, can be really unpleasant, and this is down to genetics. Small caveat, it's very rare that one particular genetic variant or gene is responsible for a big change in behaviour, called a phenotype in this field of research. But this is one of those unusual examples. As a rule of thumb, if you see a headline saying gene for X discovered, it's almost always not the case. In populations of European descent, a broad definition of which includes most people native to Europe and North America, this atypical version of the gene is extremely rare. However, in people with East Asian heritage, it's much more common, with estimates that around 1/3 to 1/2 of these populations have at least one copy of the atypical gene, or even two, one inherited from each parent. As an aside, the genetics of race is extremely complicated and contentious, so here I'm talking in broad strokes about population averages. There's actually not very good evidence for meaningful systematic genetic differences between races. So what does this gene do, and why is it a problem to have an atypical version? The gene codes for an enzyme called aldehyde dehydrogenase. This enzyme is the second step of alcohol breakdown from ethanol into acetic acid, which the body can excrete. In the first step, alcohol gets broken down by another enzyme, alcohol dehydrogenase, into acetaldehyde. Acetaldehyde is not very nice. It's pretty toxic, and it's one of the chemicals that has been blamed for the nausea that we can feel when really drunk or hungover. For people with the atypical gene and the faulty enzyme, their bodies break down alcohol into acetaldehyde, but then the faulty aldehyde dehydrogenase enzyme can't break this down any further, so unpleasant levels of it build up in the body. The upshot of this is that the individual feels sick, sweaty, headachy, and their face will flush red. As such, many people with one or two of these atypical variants will avoid alcohol altogether, which is one of the reasons that problematic alcohol use and alcohol-related cancers are rarer in East Asian populations than in European populations. Some people describe the experience of drinking with an atypical aldehyde dehydrogenase gene as like an instant hangover. But what actually is a hangover? In very simple terms, it's the awful feeling we can experience the morning or day or entire week, not that I'm speaking from experience, you understand, after a heavy night of alcohol drinking. This can include being unable to move more than a few feet from the loo in case you're sick, a pounding headache that's sensitive to noise, light and even smell, aching joints, and for some people a feeling of anxiety or sadness. Yet despite this being something that many of us will have experienced, there's surprisingly little research into why we get hangovers and whether there's anything we can do to minimise the symptoms. Recently, work was published that somewhat disproved the old maxim beer before wine, feel fine, wine before beer, feel queer. In a sample of 90 individuals, hangover severity was not affected by the order in which different alcoholic drinks were presented. There is, however, some evidence that type of drink consumed could impact on a hangover. Alcohol that is darker in colour tends to contain more compounds called congeners, and there's some evidence from the 1970s that suggested that congener heavy alcohol, like brandy or red wine, led to more risk of hangover than clear spirits like gin or vodka. This area of research was recently updated, and researchers found that while individuals reported feeling worse after consuming bourbon compared to vodka, when they were tested on a number of metrics including sleep, memory, and reaction times, there was no difference between the groups. There are a number of research groups who have recently started looking in more depth into the hangover and its effect on us. One is led by Dr. Sally Adams at the University of Bath. She and her team recently published a paper that systematically reviewed all the research published to date that investigated the impact of hangover on cognition. They found 19 research papers that had investigated this question, and concluded that the evidence to date suggests we're likely to be impaired in our ability to perform tasks that require sustained attention, not only while we're drunk, but the next day as well. They also found evidence that a hangover might impact on our ability to drive, so even after we'd pass a breathalyzer test, we might want to think twice before getting behind the wheel if we're feeling wretched. What are the longer-term effects? Long-term alcohol use is known to increase the risk of liver problems. Heavy drinking, even in the short term, can lead to a build-up of fat in the liver, which is a reversible warning sign of alcohol-related liver disease. If the liver isn't given a break from alcohol to recover, more serious disease can set in, with symptoms often not being seen until the liver is substantially damaged. There is a large body of evidence causally linking alcohol to 7 types of cancer, including breast cancer, liver cancer, mouth cancer, and bowel cancer. The charity Cancer Research UK have stated that alcohol is responsible for approximately 4% of UK cancer diagnoses. As an example, people who drink one typical alcoholic drink a day have an estimated 20% increased risk of mouth cancer compared to those who don't drink at all, which sounds like a massive increase. But mouth cancer is fairly rare. Around 5 in 1,000 non-drinkers will develop mouth cancer at some point in their life, and a 20% increased risk roughly equates to 1 more diagnosis of cancer per 1,000 individuals. Heavier drinking increases your risk more. If everyone drank at least 44 units a week, about 4.5 bottles of wine, that would result in 11 extra cases of mouth cancer per 1,000 individuals, on top of the baseline 5. This illustrates the difference between what's called a relative risk and an absolute risk. Describing something as a 20% increased risk is a relative risk, and these are often the figures the media will report as they sound really dramatic. But if you, as an individual, want to make an informed choice about whether to do something or not, the absolute risk is far more informative. Relative risks can look massive, but if the underlying risk is extremely low, then increasing it by 20%, even 50%, will still result in a low, albeit ever so slightly higher, risk. Alcohol can be dependence-forming. About 9% of men and 4% of women in the UK show symptoms of alcohol dependence. However, the term alcoholic to describe people with alcohol dependence is falling out of favour among many researchers, clinicians, and policymakers. While some in the past have said that defining alcohol problems as a disease, alcoholism, can shift stigma away from an individual, others fear that such labels are equally stigmatising, implying rock bottom and a lifelong diagnosis. As well as this, the term might create an othering of problematic alcohol use, giving some people something like a get-out clause. Oh well, my drinking isn't as bad as that. I'm not an alcoholic, so I don't need to do anything about my drinking. Problematic alcohol use exists on a spectrum, and people can improve their relationship with alcohol even if they haven't yet reached a severe problem. All this isn't to say that the term is not useful to an individual. I've met a number of people who self-identify as an alcoholic, and some told me that it helps them in terms of maintaining their abstinence from alcohol and avoiding relapse. However, they also said that self-identifying as an alcoholic is worlds away from being labelled an alcoholic by other people or society, as with other addictions, and this is explored in more detail in the addiction chapter. Stigma is high towards people with alcohol use disorder, which can impact their recovery, their ability to find employment, and all sorts of aspects of their lives. Alcohol tolerance builds up over time, meaning a person needs to consume more alcohol to get the same effect, and it can be a struggle to cut down even when a person has health problems. There are also physical withdrawal symptoms when trying to quit alcohol, and these can include seizures and can potentially be extremely dangerous. Also, as alcohol tolerance will reduce if a person abstains, overdosing on alcohol during relapse is easily done and can have severe, even fatal consequences. Long-term alcohol use can impact negatively on an individual's mental health. It has been linked to increased risk of depression and anxiety, to memory impairment, and to increased levels of stress. Although, as with other substances, understanding the links with mental health is more challenging than for physical health. And yet, many people will use alcohol as a method of managing their anxiety, in particular social anxiety. I'm sure lots of us have done this. Imagine you have to go to a party, perhaps organised by a friend of a friend. You're not going to know anyone there, you're not going to like the music, and you'd really rather not go. In this circumstance, many people would use alcohol to make the party more bearable. For those with more severe anxiety, perhaps untreated, alcohol can seem like an easy and socially acceptable method for self-medication. It's even marketed as such. Keep calm and drink Prosecco, mummy needs her gin. And this appears to be particularly the case where women are concerned. But using alcohol in this way, sometimes referred to as drinking to cope, is likely to be maladaptive. As I mentioned earlier, alcohol use is associated with an increased risk of depression and anxiety. So while in the short term a drink or two might help with your current situation, in the long run it might be making things worse. Set and setting are important here. Alcohol intoxication will be affected by where you are and your state of mind. If you are unhappy or anxious and you start drinking, you might initially feel better, but this could easily end up with you feeling awful and crying in the toilets. I speak from painful experience here. Can alcohol be good for you? You've probably at some point seen headlines saying a glass of red wine is good for you. Sadly, the evidence doesn't really back this up. There have been a few studies of a chemical called resveratrol, which is found in red grape skins and therefore in red wine. In animal studies and cell culture studies, this chemical has been linked to benefits for diabetes, neurodegenerative diseases, and even cancer. However, scaling this up to humans has been challenging because the quantity of resveratrol you'll have to consume is enormous, and consuming that dose even in trials of extracted resveratrol has been very difficult. This doesn't mean that resveratrol doesn't have any beneficial effects, but at the moment we simply don't have enough evidence. And of course, resveratrol isn't the only chemical in red wine, and we know that alcohol causes 7 types of cancer. So to say that red wine might be beneficial for cancer is just plain wrong. More controversial are findings that suggest a beneficial effect of drinking a small amount of alcohol compared to none, in particular around the risk for heart disease or stroke. There is some disagreement in academic circles around this so-called J-shaped curve. Looking at these graphs, it seems to indicate that not drinking any alcohol at all is more dangerous than drinking a small amount, but plenty of academics are sceptical about this. As we've already discussed, not drinking any alcohol at all is surprisingly rare, and the people who choose not to drink anything are different from the people who drink a small amount. I know that when I'm unwell, I'm less keen to drink alcohol, so it's plausible that if I had a long-term illness, I might stop drinking altogether. People might also be advised, if their health is poor, to stop drinking by their doctor. Another group of people who don't drink at all are those managing alcohol dependence. Some people choose not to drink alcohol for religious reasons. And there are loads of other people who don't drink who come from all walks of life. Not everyone who doesn't drink is likely to have poor health, but if enough do, that is likely to skew any findings. It's not surprising that people who drink a lot of alcohol have an increased risk of health problems of all kinds. So what about these people who drink a small amount and seem to be the most healthy? Well, perhaps they're just the healthiest group to begin with. Maybe they do the most exercise, are the most well-off, or eat the most healthily. These sound like generalizations, and they absolutely are. There will be people who fit all these descriptions who don't drink anything, and people who have long-term illnesses who drink a small amount of alcohol. But when we do observational studies, we look at the population level, so it's about the majority. This is again a problem with using observational cohort studies. People who don't drink at all are, on the whole, different from people who drink a small amount, and accounting for these differences is difficult. It's also why we get anomalies like the 80-year-old granny who smokes like a chimney that everyone seems to know. We're always talking about differences in risk at the level of a whole population rather than for an individual. But there is one way in which alcohol is extremely beneficial for health, and in fact, you've probably encountered it every time you've been to a hospital. Not to drink, though. Alcohol hand sanitizer is extremely effective at reducing the spread of bacteria and germs. And we drink it for fun. More curiously, alcohol does seem to have some other unusual effects that could potentially be seen as being good for us. Some of my former colleagues at the University of Bristol have found some really interesting results when they brought people into the lab and asked them to consume alcohol. After doing this, they got the intoxicated people to rate the attractiveness of faces of the same gender, the opposite gender, and some images of landscapes. As might be expected, the so-called beer goggles effect was found. Intoxicated individuals rated all stimuli as more attractive than people who'd been given a placebo, non-alcoholic drink did. However, when the same researchers followed up their findings in a naturalistic environment, they took their stimuli in a breathalyzer into a local pub, they weren't able to replicate these findings. Does that mean the beer goggles effect is a myth? Maybe, although the levels of alcohol in the pub setting were on the lower end of intoxicated, and the effect has previously been found to increase with dose. But still, this says something interesting about how we conduct experiments on alcohol. Often these are done in a lab in a university department. A participant coming in and being given alcohol, then asked to rate a load of faces, might be primed to please the experimenter, however hard we try and avoid this through clever or thoughtful study designs. And these kinds of designs are not really representative of how we drink in the real world. Drinking is often, though not always, a social occasion, and rarely something that we do sitting on our own in a university building, which is not to say that there isn't value in conducting lab studies, and some universities have novel ways to get around this problem. At the University of Liverpool, where I work, researchers have built a bespoke bar lab in the psychology department. It's an amazing space, decked out to look like a bar or a pub, but with the ability to control the surrounding environment to increase consistency, something that's much harder to do when you take the study out into the real world. More recently, the group in Bristol have continued their research into alcohol and attractiveness and found something really surprising. They brought people into the lab and gave them varying quantities of alcohol, but rather than asking them to rate the attractiveness of other people, they took their photograph before and after alcohol. They then showed these pairs of photos to other people and found that how intoxicated an individual is will impact on how attractive other people find them. A small amount of alcohol, roughly equivalent to 1 glass of wine, was associated with the highest ratings of attractiveness. Any more alcohol than this and the effect went away, but I find this finding completely fascinating. There's a lot of research from evolutionary psychology that has indicated that skin tone impacts on rates of attractiveness. Perhaps the mild flush in a person's cheeks after alcohol can lead to this subtle effect. Perhaps a person is more relaxed or maybe less inhibited is a more accurate way of phrasing this, after a small amount of alcohol, and so is more at ease in front of the camera. It's impossible to say from these findings, but it might be another part of the puzzle that explains why increased levels of risky sexual behaviour are seen after alcohol intoxication. The heady mix of lower inhibitions, potentially finding others more attractive, and looking more attractive yourself could be quite the cocktail of risk behaviours. What don't we know? There's still a surprisingly large list of things we know little about regarding our drug of choice. For example, we know that alcohol is a teratogen, that is, it can cause damage to a developing fetus. But the risk of consuming a very small amount of alcohol during pregnancy is less clear. At the moment, the guidelines in the UK recommend avoiding alcohol if trying to conceive and during pregnancy. And we know that regular drinking while pregnant can lead to fetal alcohol syndrome, and that there is more of a spectrum of fetal alcohol effects than previously thought, meaning even a moderate amount of alcohol could impact on the fetus. A recent systematic review concluded that even though evidence was sparse, there were some studies that found an association with preterm delivery and smaller babies, even at very low levels of alcohol consumption during pregnancy. These outcomes are themselves risk factors for other negative outcomes in childhood, suggesting that any alcohol during pregnancy should be avoided wherever possible. Of course, if a woman has gone out drinking and then finds out she is pregnant, it is not true that there will have been damage caused to the child. And it is important that women and healthcare professionals are able to have honest, judgment-free conversations to ensure adequate support to make the rest of her pregnancy alcohol-free, rather than a woman feeling stressed and guilty when she finds out she is pregnant and potentially not wanting to speak to her healthcare provider about this. That said, the sparse evidence we have to date suggests that the precautionary principle endorsed by the UK guidelines at present is sensible advice for women who are planning a pregnancy and for those who are already pregnant.